So I was born in Orange County, California, and we moved here when I was 3 years old. And I was always like athletic, and we did a bunch of stuff like that, me and my brother. And then one time we went out back east and we got into roller hockey, and then we came back here and it was a little too hot in Arizona for roller hockey. So we went to the ice hockey rink. I started figure skating and my brother started playing hockey. But then when I started seeing my brother playing hockey and all the fans were there and all the families, I was like, hey, no one comes to my figure skating competitions. And so I was like, I'm gonna switch to hockey. So I switched to hockey. There isn't a lot of options for female hockey players in Arizona. So they shipped me off to live. Yeah, they shipped me.
That's not really nice.
They
shipped her off.
They let me go. They paid my way to go to a boarding school in Vermont and play ice hockey there. So I had already spent a year up in Vermont for the first time, and I was back here. And I started noticing that my joints were in so much pain. My one knee was in pain, and I could not walk. My legs were buckling. It was the weirdest thing. So that was the first indicator of like, wow, my body just seems like it's not keeping up with what it should be keeping up with. I started feeling very depressed. My emotions were not, I was like a different person. I'm a very happy, bubbly person. And I mean, she can tell you I don't even know who I was.
Then this just violent stomach issues, throwing up, black. I mean, she was, it was just crazy stuff. And so she went in that weekend to the hospital. They hydrated her, told her it was the stomach flu, gave her some Zofran and some other stuff, sent her back, and she ended up the following, I think it was 5 to 7 days later, getting it all over again. We were just, I was like, there's something bigger than than everybody's telling us, because it's just not normal for her. She never got sick.
I was always tired and like just sad and all those things, and so
she was really sad. So I have a friend who's a pharmacist. We went to her and she did a full panel. She checked Hannah for about 2 hours. She did an inspection from head to toe and went all the way back to childhood and said, you know, I just have this. So I got a hunch that's the left side, your shoulder, your knee, and some of your symptoms. I want to test for Lyme. We did the Lyme test.
Lyme test?
Yeah, and then I just went all out investigation on Lyme. I went up all night, I can't tell you for how long, and I just started investigating as much as I could on Lyme, on places to go for Lyme, on treatments, how people got that, testimonials of people that got that, and just did all the research I can, and then like Envita.
And I was so tired of just doctor hopping around and trying to figure out who could help me, because it seems like no one. I mean, I went to a normal doctor, my family doctor, and he told me, I swear, he said, you should quit hockey because it's making you depressed, and it's obviously not. And I was like, that's what I love to do. Honestly, when I thought of like a treatment center, I was like, okay, it's gonna be stone cold, white walls, you know, I'm just gonna be kind of like hospital-ish. And so when I came here and it's so warm and inviting, I was pleasantly surprised to find out that it was going to be my second home, kind of, you know. I mean, I'm here for 7 to 8 hours every day.
And I felt like this was the right place, the right fit. They were doing all the antibiotics, but also doing all the immune boost at the same time, while doing the natural path medicines and sides of it. After doing all the investigating that I did, there are people that do the natural and there are people that do the antibiotics, but I was hard pressed to find both.
When I came here in the big comfy chairs, that was my favorite thing.
She does like the recliners.
The recliners are very nice, and the TV, and all the other patients that were here were so great and so friendly, especially for people who are coming here from out of state. They don't know anyone here, you know, and it's nice to have, like, the nurses became my friends and family, and like, it was such just a relaxing place to be, even at a not so relaxing time in my life. It's been a complete 360 for me. I have energy, I'm happy again, my joint pain is gone. I mean, I lost most of my hair, so now that's starting to grow back, and my hormones are in place, and it's just crazy to think a year ago today where I was at. If I didn't have the great staff that you guys gave me and the great, you know, environment and medicine and all that stuff, I don't think that mentally I would be here, and physically I wouldn't be here. Being able to play college hockey, that's what I'm most excited about, and just chasing my dream again, because since I was little I've always wanted to be an Olympian, I've always wanted those things, and I had such a good shot, and I still do, but this was more of like an obstacle. And now that I can actually look at it as an obstacle, not something that's stopping me completely, that's probably my favorite